Medicine, the world of wonders. I am touching up on some medical knowledge in preparation of the board exam coming up in 2 months. I feel somewhat prepared, for I have been taught by one of the most prestigious PA programs in the United States. To save lives. That's what it's all about. With today's technology, we are pretty much capable to resuscitate inanimate objects and bring them to life. Makes me feel glad that I chose medicine for my career path. To help those in need is such a rewarding concept. To play God at times, so they say. Nevertheless, this is not always the case. Over my experiences, especially in the past 2 months, the focus is on letting go. Now we are being taught ways to let go. How to approach the family, asking questions and their advice, palliative care, making the patient comfortable. There is no true technology needed. Mainly the psyche, the psychological aspect of medicine comes to play. Our own values, previous experiences, and education are the only tools that arm us in preparation of dealing with death. This seems to be a mission. Impossible. Hi, my name is Tom. I attend PA school at Barry University. I am finally closing a chapter in my life by completing the program. But in order to do that, I must now focus on thanatology. My project, pediatric death and dying. It's not really a fun topic to talk about, but to be an exceptional healthcare provider that we are all striving to be, we must be exposed to such information. So when the time comes, we will be prepared to face those involved, including ourselves. Well, it's about time. Ethan Hunt has paged me. I have to let him know what to add to the PowerPoint presentation. Pediatrics are thought to be indestructible by many, or in other words, they respond better than an adult to life-saving treatment. The most common life-threatening illness in children are those involving respiratory, cardiac, or neurologic failure, but trauma is a leading cause of death in children and young adults, and is responsible for more childhood deaths than all other causes combined. Mr. Hunt, how is the project?
Galitzin's gone. They knew we were coming, man. They knew we were coming, and the disc is gone.
The disc is gone?
Disc is gone. Do you read me? The list is in the open!
My PowerPoint presentation? Listen, were you followed?
I don't think so.
Okay, meet me at the station in 1 hour. I will be there myself.
1 hour.
Damn! I cannot believe the presentation is gone. At least I remember it all. A child usually presents in obvious distress with respiratory emergencies. A major challenge is to avoid irritation of the airway, which can precipitate to complete airway obstruction. Common respiratory emergencies are asthma, epiglottitis, croup, foreign airway obstruction, which can all precipitate to cardiac arrest. Listen, Ethan, I know how much Jim had meant to you, both personally and professionally.
Yeah.
I know the disc is gone. Maybe we can make a video. Besides, I have a good visual memory. Do you follow me?
Yeah, I follow.
Good. Let me review. Cardiopulmonary arrest is a result of a primary cardiac event. Rather, full arrest in children is usually a result of untreated hypoxemia or untreated shock. By the time the heart has sustained a sufficient hypoxic insult to result in asystole, the central nervous system has sustained a severe asphyxial insult as well.
Who else is left?
I know this is tough, Ethan, but this accounts for the poor outcome for children who are brought to the ER without ongoing CPR. Although reported rates of discharge from the hospital for children with pre-hospital CPR range from 0 to 21%, those with good neurologic outcome were rapidly resuscitated in the field and arrived in the emergency room with a perfusing rhythm. Are you okay? Does this information bother you?
You're worried about me. Why?
I know this is tough information to take in, Ethan, but we must. I do remember talking to a doctor in the ER once about this.
Pediatrics, kids are pretty strong. Most kids, they have healthy hearts, healthy lungs. If they were going to survive, the initial resuscitation that's done in the field usually brings them back. And I've actually not experienced where they've come in here dead and I've been able to bring them back. Usually they might have been found with asystole in the field, and what the fire rescue people have done brings them back, and then they come here and then we just got to keep them going until we can get them to an intensive care unit where they can try to help them out. Those are the tougher ones because that's more like critical care, and you have more active, I feel like you have a more active role. But in those cases, you could tell the parents your child's alive but critical, and for them, that's not as hard.
Ethan's not doing so well. He will be okay tomorrow at the meeting. I know I have to work on ambulance. Called to an accident. Motor vehicle related trauma accounts for nearly half of all pediatric injuries and deaths. Contributing factors include failure to use proper passenger restraints, inexperienced adolescent drivers, and alcohol abuse. Proper use of child seat restraints and lap shoulder harnesses can prevent an estimated 65 to 75% of serious injuries and fatalities to passengers under 4 years of age. A study documented that 20% of all child safety seats examined were seriously misused, and 50% of adolescent motor vehicle fatalities involve alcohol.
If safety is a trauma alert, I'll let you know when
In
we're en
fact,
route.
a large portion of all pediatric motor vehicle occupant deaths occur in vehicles operated by inebriated drivers. I remember a good friend Larry and his experience.
Would have been when I was back in Massachusetts. We had a 8-year-old girl. She was riding with her father in a vehicle, nicely restrained and everything. Basically probably should not have, ended up dying. Got into a motor vehicle accident. Father's side of the car wasn't damaged at all. He was fine. Somebody ended up pulling her out of the vehicle, and that was never the proven factor as to whether the person who pulled her out ever caused further injury or not. But we ended up finding her on the ground, basically in a puddle. And I can remember it as almost like it was yesterday. Blonde-haired, blue-eyed girl with a white dress. Got down in a pile of mud, intubated her, And part of the reason I can remember it is I still have the letter at home written by the fire chief who had wrote my boss and was asking him how in the world his paramedic could function and do what he had to do, because the chief says I was looking at him and the tears that were coming from his eyes, it was like I can't imagine how he ever intubated this kid and continued to do what he had to do, because it looked like at any second it was going to be a massive faucet. And like I said earlier, you got to do what you got to do and let the emotions get to you after.
Hey guys, do you remember the part in our PowerPoint presentation on bicycle-related trauma?
I don't know.
Well, every year, approximately 200,000 adolescents and children are injured, and more than 600 die from bicycle-related trauma. Head injuries cause most bicycle-related morbidity and mortality. And bicycle-related trauma is a leading cause of severe pediatric closed head injuries. The use of bicycle helmets can prevent an estimated 85% of head injuries and 88% of brain injury. But most parents are unaware of the need for helmets, and many children just are reluctant to wear them. This brings in mind my friend Larry, who I once spoke to about this.
There was a girl riding a bicycle, and let's see, that would be about a year and a half now, and she still sits in my mind for a couple of reasons. Birth date was the same as my daughter, size was the same as my daughter, color was the same the color of the hair was the same as my daughter's. It was like everything you want to watch. Deafening motion, that was a very difficult one to do, but again, you got to do what you have to do at the scene, and unfortunately, again, her outcome wasn't that great either. She didn't make it. Not that I don't believe everybody didn't try very hard, including the hospital. It just was one of those unfortunate accidents. And in this particular case, even helmets don't necessarily, she wasn't wearing a helmet, so maybe if she was, the helmet would not have allowed as much skull damage and fractures. And I guess it's just going to be one of those things we will never really know. But if you just take in both pediatrics and even if you go to adults, you look at some of the accidents, and if they're wearing the proper equipment, they're wearing their seat belts, they don't get hurt as bad.
You know what? We really need to get that disc back.
Is he serious?
Always.
What do you think, Tom? I mean, Mr. Hunt?
We're going to do it.
Ethan, you think we'll fit? Good thing internal dialogues don't register on the decibel meter. Down he goes, into the murky waters of danger. Much like the waters that claim the lives of many children, childhood submersion is too commonly a cause of injury and fatality. Two age groups are at particular risk: toddlers who commonly drown in residential swimming pools during brief periods of inadequate supervision, and older adolescent males, 15 to 19-year-old, who often drown in natural bodies of water, frequently in association with risk-taking behavior. alcohol intoxication, or drug use. Anyhow, residential swimming pools are the site of almost 90% of submersion in children less than 5 years old. Most pool submersion events occur at the child's own home, and nearly half occur within the first 6 months of pool exposure.
Actually, I can remember one time I was dispatched to a local lake in town, and it came in as a child who had drowned. And I can really remember on the way to the call thinking about what had happened. And in a case like that, my first reaction is to wonder, how could something like this have happened? Where were the parents? Why don't they teach these kids to swim at an earlier age than they do? This turned out to be a 5-year-old, and I know that they have swim lesson classes for children at a much earlier age than that, and this kid obviously didn't know how to handle himself in the water.
I think it's a lot harder on a parent who's raised a normal, healthy kid. They're an 8-year-old, and they were found at the bottom of the pool, and now you're suddenly hitting them with the child's dead. Whereas opposed to another child that was born with medical problems and struggled with medical problems up until maybe 2-3 years of life and then died at that point. Sometimes those people feel like, God's on their side or luck is on their side, and their child has won all the battles up to that point, and now you're telling them the child's dead, and it's hard for them to accept. But I'm sure they've thought about it before, whereas the healthy child that dies of an accident is, I think that's harder for us to accept.
That was a long day. I'm kinda glad that we lost that disc for a while, because it kinda helped me gather all this information in my mind. Now I cannot wait to get to bed so I can sleep off all these troubling emotions. Nyla, I'm glad she's here. I just had a bad dream that she jumped off that cliff after injecting herself with that bad virus. It almost reminds me of the time I talked to Larry about suicides.
One that comes to mind, the kid was only like 12 or 13 years old, and he was more or less trying to impress his girlfriend. And he was basically, the thought was, if you don't come back to me type routine, I'm going to kill myself. Well, the kid decided to make the good old hangman's noose, put it onto a pipe drain at one of the local schools, and figured that he'd be standing on the pipe, he'd get her to express her concern, love, whatever, and she'd come back to him. He'd just undo the noose and jump down, and everything would be happy. Well, unfortunately, it was a Friday night that was raining, and the kid's foot actually slipped off the drain pipe, and he did a very good job because he ended up hanging himself.
Yeah, deaths provoke some kind of professional or emotional response, which may be positive or negative. Yeah, the death of a child as compared to an adult is likely to provoke some particular feelings of powerlessness, unfairness, and personal vulnerability. Yeah, it makes me feel better that you are here with me, Nyla. But in part, these feelings stem from the tendency of people in developed nations to view children as having a right to attend adulthood and to fulfill the expectation for a general sequence. In addition, the pediatrician's specific orientation towards new, growing, and developing life can make managing a child's death especially emotionally difficult.
I've been asked to speak about the first experience I had where I had a baby not survive. term baby, and actually it happened a long time ago when I was in New York. I was an intern. And they called me for, which I do all the time, for a baby which has a bad fetal heart. And it had never happened to me at the time that I could not bring the baby back. Basically, we brought the baby back, and I was too young to see the long-term effects, so it seems like we were heroes. We resuscitated the baby. But I remember it was the first time that I did. I went down. I was all by myself. I was an intern. I didn't have my senior resident, and I did everything right, but the baby did not come back. And it was a young couple that started crying, and actually, I cried with them. I cried with them, and it was a stillbirth, and I forgot what it was related to.
After the call was over, when I got home, on my refrigerator at home, there was a picture that my son had done in preschool, and it was very similar to a picture that was on that family's refrigerator at their home. I didn't even see it or make a conscious note of it. During the call, when I got home, I saw it and made the connection. And that call really kind of stuck with me for a while.
Personally, I usually tell everybody to leave me alone for a while. And it's the one thing is, like, I will do what I have to do while I'm taking care of the child. As an example, I will use our 15, 14-year-old girl at the time that got hit by the car. I turned care over to the hospital, gave them the report, stood in the room for a little while. The doctor said he was all set with me. I went outside, leaned against the ambulance, and then I punched the side of it about 4 or 5 times. I can remember one of the security guards of the hospital coming out and asking me if I was okay. I'm sure he didn't really like the response I gave him. It probably had more 4-letter words in it than the English dictionary holds. Right after that, the medical director came out, and we had a nice little chat. And it was very, very emotional for me with her. Very hard to let go of that particular one. It's one of the true times I thank the CISD team, Critical Incident Stress Debriefing teams, for getting involved. I can honestly say with her, I fit a lot of the characteristics of what they say will happen. The nightmares, the night sweats, the whole thing with her. I'd say she stuck with me for a good 2.5, 3 weeks.
We end up seeing death, and we end up seeing death over time. You end up seeing it a lot. I think you do distance yourself. It's normal to distance yourself, especially if the child comes in already dead and you make your best effort and they stay dead, then you don't really feel as involved because it's nothing, really you had nothing to do with it. You couldn't bring them back. They were too far gone.
Oh crap. I gotta get that video from Ethan. I'm here for the disc.
Don't you mean this?
Come on, Ethan. The presentation is tomorrow. Don't lose it again.
What's the matter? You've never seen this trick?
That's not funny, Ethan.
Where'd it go?
What? What's this? What? You're a podiatry mole.
Yes, and he was. He was carrying 2 discs. It's so hard to keep track of these things.
That explains your gross incompetence from the beginning. That's probably not the real presentation anyhow. I'm out of here. Home again. Released, finally, from the confines of my penthouse, I returned to my preparation for the boards, and I have time to reflect on the past days. Despite the best efforts of the podiatry students to infiltrate and destroy my project, I still managed to succeed. I guess there are so many paths of learning in medicine. We need not to depend upon the PowerPoint presentations or lectures to convey some of the most emotionally challenging topics. The death and dying process of pediatric patients is best discussed in the audience of our peers by those who have gone before us in this field. I am thankful to be surrounded by so many with such experience. It seems that to learn the art of caring is far from a mission impossible.